When the pain physician tells the patient that the best treatment is injection and not medication, many patients doesn't know what an injection means. They think it is an injection like any other injections taken intramuscularly, which is entirely incorrect. Injections are often performed in operating room and under X-ray or ultrasound. What are the instructions that the patient must follow? What do you expect on this day? Does the pain disappear immediately after injection? That's what I'm going to explain in this episode. Let us watch. Bismillahirrahmanirrahim, a new episode for Pain Relief Educational Channel. Today, inshallah, I will talk about an important topic, as many of the channel followers and from my patient ask me to speak about it, because there is a lot of confusion. Often the information is not clear in our mind, especially this topic is relatively new and hardly we meet someone around us to ask about their personal experience. I'm going to talk about pain procedures. What are their importance? What are the requirements for their action? What to expect on the injection day? And what instructions before and after injection? Please subscribe to the Pain Relief Educational Channel to be notified of a new episode. Like the video to improve the search for this highly needed correct medical information to spread awareness about pain management. In previous episodes, I explained to you that there are known protocols for dealing with various kinds of chronic pain. In many cases, we started with conservative treatment, meaning that medication and physiotherapy, and if we don't find the desired result, we turn to an interventional treatment. In other cases, we started directly with the interventional treatment, which is the injections. Injections are of two types. There is diagnostic and therapeutic injections. The diagnostic injections mean that the doctor suspects a specific nerve, joint, or ligaments problem. So he gives a temporary anesthesia to this part. If the pain disappears, this confirms the diagnosis. On the other hand, therapeutic injections mean that we know the cause of the problem and we inject a specific place to eliminate the pain for a long time. The preparation for two injections is the same, despite the significant differences. Likewise, when we travel by a plane, the preparation is the same and there is no difference between a half-hour or 10-hour flights. This is exactly the same. So as a patient, we shouldn't be afraid when we see a lot of preparation and instruction from the medical team. These are all preset protocols to maintain your safety and ensure the success of the injection. If the doctor thinks that the patient needs an injection, he will explain what he intended to do and the possible side effects and success rate of the procedure. If the patient agrees, he or she should sign a consent, and the nurse also sign as a witness. This is the first step. The second step is the doctor may order a specific blood test, X-ray or MRI, according to the diagnosis and type of the injection. There are instructions before a day of the procedure. All patients must be adhered to these instructions to avoid any problem or complications. Instructions include: number 1, fasting, 6 hours for food and 3 hours for water before the injection. We advise all the patients to fast, even patients who will not be anesthetized. Number 2, stop your blood thinning medication at least for 12 hours before the injection. The duration may increase according to the dose of your blood thinner medicine. Number 3, blood pressure medication should be taken on the morning of procedure with a bit of water. Number 4, not to take any diabetes medication, as this may lower your blood sugar while you are fasting. Number 5, the rest of the medications, the doctor should decide what to be taken before or after the injection according to each patient condition and according to the type of injection. Number 6, and this is very important, if the injection is diagnostic, then no analgesic should be taken the day before the injection to know the result of this test. If the patient comes while he is on painkiller and there is no pain, it will not be possible to know the result of the injection. In this case, the procedure will be postponed to another day. Information we must know before the day of the injection. Number 1, if there is a change in the patient's health condition, the doctor must be informed as soon as possible. For example, if the patient got an infection or fever or become pregnant, as this may affect the injection decision. Number 2, we always advise against traveling within 2 weeks of the injection. So if any complications appear, they must be dealt timely. Number 3, if the patient suffers from diabetes and cortisone was injected, a rise of blood sugar may occur for several days, and the treatment should be adjusted to reduce the blood sugar to the normal level. What happens on the day of the injection? What we are expecting. On the day of injection, the patient should go to the hospital on the determined time by the medical team. In the patient's room, the clothes are changed to a sterile operating clothes. The injection is usually done either in a clean, sterile room designed for this matter or inside the operating room, because the injection requires a specific equipment. Before the procedure, the doctor and the medical team will review the patient's condition, and you will be asked about average pain score and timing of the last dose of your blood thinner. In many cases, we give the patient sedation to facilitate injection. However, in certain procedures, it is necessary to communicate with the patient during injection. In this case, no sedation will be given. Whether or not anesthesia is administered depends on the type of the problem and not on the patient desire. Generally, in both cases, the doctor will administer a sufficient amount of local anesthetic to numb the skin and needle bath to reduce the feeling of pain during the procedure. The injection site will be sterilized with antibacterial disinfectant. The sterilized liquid usually has a yellow or brown color, which is stay on the skin for 24 hours. Then a sterile drapes are applied around the area to ensure that no infection will occur during the injection. Injection, as I said, are performed under X-ray or ultrasound according to the type of the procedure. The expected duration of the injection is about 15 minutes in most of cases. Certainly, more time is needed in some special cases, but the doctor will tell you in advance about that. After injection, the doctor will cover the injection site with a sterile cover. In most cases, the pain decreases directly, but in some specific types of injection, the patient may feel more pain for several days, which disappears gradually. After the procedure, the patient will be monitored for a short period in the recovery room and then for several hours in the ward. All patients will discharge from the hospital on the same day. Instructions after injection. Number 1, patient should not be permitted to drive the car on this day under any circumstances, which is a violation of a law in many countries. Therefore, it is preferable to have a companion when leaving the hospital. Number 2, it is not allowed to dip in the bathtub or swim on the first day after the injection, but it is possible to take a shower. Number 3, on the next day, the plaster of the injection site can be removed. Number 4, In the first period after injection, it's preferable to have someone at home with the patient, or at least ability to communicate with one of the relatives by phone. Number 5, if any unexpected symptoms occur, the patient should immediately contact the doctor or go to the nearest emergency room to check his condition and determine if there is a problem or not. Number 6, an important question all patients ask: when we can return to work. It depends on the type of the injection and nature of the work, whether it's manual or office work. However, we advise the rest between 2 to 7 days, then gradually resume normal activity. The doctor will see you between 2 to 4 weeks after the injection to evaluate your condition and decide about next step. This is in general what all pain physicians do. However, there is always differences in the protocol from one country to another or from one physician to another. That's all what I want to say about this topic. I hope I give you a clear and simple idea about what to expect, and I wish you a good life without pain. Wassalamu alaikum wa rahmatullahi wa barakatuh. Thank you.